look around, you might see people wearing all kinds of them. Masks covering their mouth and nose. A new movement known on social media as Masks for All, now even getting the endorsement of Pennsylvania Republican Senator Pat Toomey, who posted this video on Twitter.
My mask will keep someone else safe, and their mask will keep me safe.
Toomey says he's not talking about the high-quality masks that health professionals need and that should be reserved for them, but he is talking about ones you can make yourself.
I think it's just common sense that some kind of shield over your face, a homemade mask, even a scarf or a bandana, anything that would tend to stop those droplets from traveling will also tend to slow down the rate of transmission.
Are you worried that people might feel more protected? They might feel like they can get closer to people than they should if they're wearing a mask?
You know, I think of those as kind of second-order challenges. Sure, it's possible, but the first-order consequence of wearing some kind of face covering, some kind of mask, is that you're spreading fewer droplets that could infect someone else.
Right now, the CDC on its website says you should only wear a face mask if a healthcare professional recommends it. The website does not specifically address homemade masks.
I am urging the CDC to change its guidance. I spoke with the President of the United States earlier today, and I urged him to consider suggesting this as a behavioral norm. And he's open to that. He did not make a commitment, but he did acknowledge that his team is evaluating that.
Do you want him to speak publicly and talk to the American public about this, or are you asking him to go to the CDC and have them update their recommendations?
I'm asking for both.
Does wearing masks keep us safer?
Well, I think that's a fair question and a good question. I think the answer right now is we don't really know.
We went to Dr. Calvin Johnson, former Pennsylvania Secretary of Health.
Really, we need to focus on is the consistent and clear message for the evidence-based practices that we know make a difference. Washing your hands with soapy water, coughing or sneezing into the crux of your arm to try and decrease any spray of droplets, cleaning surfaces frequently and being careful not to touch those surfaces and to touch your face.
And he says keeping a safe distance from others.
There may be a time for masks, and we may be at that time soon, but right now, I don't think we're there.
I also asked Senator Toomey today, how do you prevent people from taking those special masks that hospitals need? And he said that you do that through education. I also reached out today to the CDC for information about their recommendations, but have not yet heard back. In the Montgomery County Bureau, I'm Mayk, NBC10 News.